As part of today's study session, we'll be covering hypomania. A hypomanic episode is a distinct period of abnormally and persistently elevated, expansive, or irritable mood and abnormally or persistently increased activity or energy, lasting at least 4 consecutive days and present most of the day, nearly every day. The emotions and the behaviors during a hypomanic episode must be distinct from the individual's usual functioning and emotional range. Hypomanic episodes are similar to manic episodes in that both diagnoses require the presence of at least 3 of the following symptoms during the mood disturbance: inflated self-esteem or grandiosity, decreased need for sleep, increased talkativeness or pressured speech, racing thoughts or flight of ideas, distractibility, an increase in goal-directed activity or psychomotor agitation, and excessive involvement in pleasurable activities in which there is a high risk for potential of painful consequences, for example, shopping sprees or sexual indiscretions. Although the symptoms are described in the same manner, and there is a change in the functioning that is uncharacteristic of the individual when not symptomatic, a hypomanic episode leads to less impairment than a manic episode. Individuals with hypomania do not experience the same marked impairment in social or occupational functioning, nor do they require hospitalization, and they do not display the psychotic symptoms that may be present in a manic episode. For a hypomanic episode to be diagnosed in a child or in an adolescent, the symptoms must exceed cultural and environmental expectations for that child or youth developmental stage. Hypomania may be difficult to recognize, as individuals in hypomanic episodes may simply appear to be extremely cheerful, energetic, or exuberant, and may consider their symptoms pleasurable, at least initially. Individuals may become excessively verbose or loud, but can usually be understood and interrupted. People experiencing hypomanic episodes often have heightened perceptual experiences. For example, colors are vivid, sounds, tastes, and aromas are intensely experienced. And often they become gregarious, seeking contacts to join on expansive businesses or creative endeavors. Distractibility, involving quick changes in goals and activities in speech, may be evident. As symptom intensity increases, it becomes increasingly difficult for an individual to complete projects or goals. Hypomania is characteristic of bipolar II disorder, and the diagnosis of this disorder requires a past or current episode of hypomania as well as a past or current episode of major depressive disorder, but the individual must never have had a manic episode. Most frequently, bipolar II disorder begins with a depressive disorder, and 12% of the individuals that are initially given a disorder of major depression eventually experience a hypomanic episode, leading to the recognition of bipolar II disorder. A currently given diagnosis of bipolar disorder never reverts back to a major depressive disorder. Hypomanic symptoms alone do not constitute a diagnosis of bipolar II disorder, however. Episodes of substance-induced or medication-induced bipolar or related disorder, or symptoms resulting from the physiological inherent in medical illnesses, do not count towards a diagnosis of bipolar II disorder. The exception is made for symptoms that persist beyond the physiological effects of the treatment or substance and meet the criteria for an episode. This may occur, for example, with hypomania symptoms triggered during an antidepressant treatment. But if a full syndrome, not just 1 or 2 symptoms, persists beyond the physiological effect of that treatment, it's considered sufficient evidence for a diagnosis of a hypomanic episode. Hypomanic symptoms that do not meet the criteria for a hypomanic episode, coupled with depressive symptoms that do not meet the criteria for a depressive episode, with cycles of heightened and depressed mood lasting for at least 1 year in children and adolescents or at least 2 years in adults, are suggestive of a diagnosis of cyclothymic disorder. Let's practice with a question for hypomania. Hypomania is characterized by an unequivocal change in an individual's functioning that is uncharacteristic of the person when hypomanic symptoms are not present. This change in functioning is associated with A. A decreased productivity and inefficiency, B. Increased need for sleep, C. Expansive or irritable mood, D. Increased ability for concentration. C is the correct answer, as a hypomanic episode involves increases in expansive, euphoric, or irritable mood. A is incorrect, as the opposite is true. Temporary increases in productive behavior may result. B is incorrect, as there is typically decreased need for sleep. And D is also incorrect, as the opposite is true. Distractibility rather than increased concentration is one of the symptoms of hypomania. We invite you to participate in the next chapter of our series on the key term areas affected by the DSM-5. Thanks for joining us.